them. When, for example, a child that's living in an environment where drug is accessible, where they can easily get drugs, where you have people selling it here and there, and there are no challenges, that child is prone to becoming a drug user and eventually abusing the drug. Then closely related to that is the training, the home training of the child and the type of parenting that the parents adopted. There are different types of parenting style. In most cases, the laissez-faire and the permissive parents always have their children are prone to becoming addicts or using drugs, because coupled with the fact that, especially coupled with the fact that they are living in an environment where drug is accessible, where they can easily get is as available for them to easily purchase and use. And they are now have a parents who don't really care. The laissez-faire they don't care what the child do. It's all just their own thing is to just provide for the child, and the child goes from morning to night, no questioning, no monitoring, nothing. The same thing with the permissive. They can do they are free to do anything. And also those with authoritarian, those with high-handedness. I will just give dash orders without negotiations, without, that is what I want you to do. All of these, according to psychologists, could push children to use drugs. Then the role model thing. If the children are in home itself that the parent uses drugs, because we have parents, even parents that sell drugs. Those selling drugs, let's remember that those selling drugs on the street are parents as well, and their children are seeing them. So, and they are neighbors to some children, and they are living in an environment of some other children. So it's like a circle where they live, they serve as role model, they are copied by children around them there, where they sell, where they are even parents. So when parents uses drugs, sell drugs, live in an environment where drugs is accessible, the they are prone to using drugs and then becoming addicts. Coupled with that is the fact that the peer, which is the major, apart from the home, the next most influential and diverse of drug use is the peer pressure, the peer group. What type of friends do they keep? If they are friends that are using drugs, they are prone to use drugs, except they are and there's in most cases, no matter how assertive, how strong their self-control is, they will be. Because experience have even told others, even when they say they don't want to, there are ways these friends can be putting it in maybe the food, the drink, unknowingly to the user. And before you know it, they are already used to the drugs and they cannot withdraw. Once they try withdrawing, they are prone to withdrawal symptoms. So the kind of friends they also keep is also part of it. And aside that, there are also individual drivers that comes from the individual, which could be just there's a sense of belonging. They just want to belong even to the group. Just that the group could accept them that, yes, they are part of the group, they will be forced to. Then idleness. Idleness is one of the things that can be good. It could be as a result of just like the saying, an idle hand is the devil's workshop. I hope my time is not off. Are you clear? Am I with you?
Yes, you are clear, man.
Okay.
Round up, man.
Okay.
Thank you.
So I was saying, then the urge to commit crime. People will use it when they have a desire or they have a mission to accomplish, either desirable or undesirable missions. They also people tend to use drugs when they have a mission that they cannot, especially those ones that they cannot ordinarily go face. so they get high in order to be able to carry out the mission. Then in some also uses it in order to alleviate their pain. Those are, they are traumatized, they are dissolved, they have challenges. Like I told you, home background. There are some that it is the home that pushed them to it, especially when you have broken homes, reconstituted homes, homes where stepmother, stepfather lives in, and you have these children that are being maltreated, and that sometimes they think when they use these, they get comfort, they are satisfied. It's a way of alleviating their pain, sort of, and some also use it. Their sexual and physical pleasure, especially the rapists.
Thank you, man. Thank you, Prof. Thank you for the insights, Prof. So based
Thank
on
you
what,
for that.
okay, yes, sir. Based on what, my next question goes to Mr. Said Salmon, our sheikh in the house. Based on what Prof said, some people use the drug sometimes when they believe they have some maybe social issues that they need to calm themselves down. Like, for example, I have a question for our sheikh in the house, that to what extent does unemployment and loss of purpose create vulnerabilities that religion institution can help address? The meaning of the question is this: that some people will say that because I don't have job, mo ní iṣẹ́, kò sí anything, I'm frustrated, that's this why I'm taking drug. So because of this, they assume that because of the fact that they have this social issue or psychological issue, I don't have job, I'm jobless, that is why I'm taking drug. So if I take drug, maybe I will not think about my problem again. So in this kind of issue, or in this kind of scenario, how can religious institutions, religious leaders, our pastors and our imam, how can you people assist us in this area?
We thank our creator for giving us this opportunity to meet via this platform. I want to start by saying that since we are looking at this issue from religious aspects, and I as a Muslim, we were taught in Islam that whenever we are addressing any issue, it should be looked holistically. As we are trying to prefer spiritual angle to challenge, at the same time, we must ensure that we don't neglect the mundane part of it. That's why in Quran 16, verse 89, Allah says, "We revealed Quran to you, Muhammad, sallallahu alaihi wasallam, to serve as explanation to everything." So that is a preamble. Now, coming to the question, when you talk about unemployment and when you talk about loss of purpose, automatically these two things, they are considered as major drivers of taking substance. Anybody that is being faced with this unemployment and loss of purpose, and automatically there are other things that will set in. One, idleness. I have nothing to do. I will just be wandering in the society aimlessly, not to achieve anything. Then secondly, there's what we call despair, Elias. You lose hope that I'm finished in this world. What am I doing on earth service? If I cannot have something to take care of myself, I don't know the reason why I'm on earth service. So what am I doing? So despair sets in. Then those people with such challenge, they will be looking for a way to create what we call social isolation. Because when you meet someone, they will ask you, what are you doing for a living? In trying to run away from that question and the response that is not available, such person will create for himself social isolation. But in Islam, where do we start? We start from restoring meaning for this life. Let the individual understand the purpose of his creation. Then also, why are we on earth service? Scriptural angle now. And alhamdulillah, some of our experts here today will have read one or two things about Quran, where Allah subhanahu wa ta'ala made it clear that there is nobody on earth service without a mission. And this mission, some spiritual, some mundane. So that's the first point of duty for the religious leaders. Everything is not prosperity. Let people understand why they are on earth service. Then also, there is what we refer to as referral. I could remember in counseling, then we were taught that one of the functions, duties of a counselor is referral, because religious leaders who is not a professional in a particular area, you should be able to refer. That is why Islam taught us that فَاسْأَلُوا أَهْلَ الذِّكِرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Ask those who know if you don't know a particular area. So let's assume the person is with this challenge. Religious leaders should be able to refer such person to professionals like counselors, psychologists, and what have you, to come in a way to assist such a person. Then also, there should be a structured program that such person will engage in it. I could remember, and still intact in our MSS and other Islamic organizations, this weekly usra is one of those things that we can use to assist such person from engaging in a substance. So as religious leaders, we need to create a structured engagement programs, daily activities, weekly activities, then also this mentorship of a thing. Mentorship, because someone who does not have anything doing, automatically a devil will use such person to engage in other things. So as religious leaders, we must create a structured engagement for those people. Then among which is to host job fairs. So, thinking that I'm unemployed, some people don't have information, and the information can assist them in securing a job. So if religious setting, we can have such fairs to present to people, okay, you read this, so these are the job opportunities, then this job, it has this hazards and what have you. Start from somewhere. So it's another thing the religious leaders can do. Then also, how do we write CVs? Because now I'm combining the two together. In religious setting, we don't restrict ourselves to spiritual aspect alone. Rather, we take care of the mundane aspect of it as well. Because someone they observe that you are talking to them about spiritual, they may run away. But when you combine the two together, using holistic approach to automatically, that will endear the program. That will endear the solution to them. Then also our clergy, our leaders need to be trained. We need to train them on basic mental health, first aid, then how to refer to the professionals in those areas that can be of assistance in solving that problem. And lastly, we should be able to provide purposeful volunteer roles. Because all this we are talking about, it will take your time. So nobody is paying you. Rather, you are a volunteer. So we should instill this spirit in people. Everything is not money. So as an imam or a pastor or other leaders in society, we should have that spirit to always volunteer in assisting those who are in a challenge. So these are some of those things I think if religious settings or religious leaders can put them into practice, it will assist a lot in addressing the challenge of unemployment and also loss of purpose being experienced by the youths, and which leads them to taking substance in order to take care of themselves or to protect themselves from shame and what have you. And at the end of the day, trying to engage in social isolation. With all this, I want to believe that the religious setting, the religious leaders as well should be able to handle such a challenge. Thank you.
Thank you, sir, for this scholarly contribution. So my next question goes to Dr. Aroye Omolaleye Timitokpe. Dr. Ma, how does substance abuse intersect with mental health challenges such as depression, trauma, or anxiety in the Nigerian context? You can unmute yourself.
Assalamu alaikum wa rahmatullahi wa barakatuh. Alhamdulillah rabbil alamin. It's really a delight to have this conversation, because conversations about substances is never early or late, because it's a recurring problem. Yes, there's a strong correlation between substance use and other mental health problems. It's a double arrow relationship. Sometimes it is because of substance use they develop other mental health problems. And sometimes other mental health problems are the reasons why they go into substance use. I'll give us an example. We see so many people on the streets of Lagos and Ibadan and other states, people that lose their mind. Most of them actually suffer what we call psychosis, meaning that they are not in touch with reality. Now, sometimes people genetically develop psychosis. Probably they have that loading from family or because of life stress and so on. While some other people actually develop psychosis because they started taking drugs. Now, we now have different types of drugs. We have drugs you can inhale, like glue. We have drugs like our popular laughing gas. It's also a type of drug. We have drugs that can be smoked. We have drugs that can be injected. And all of these drugs, they all just like it was said earlier, they all find their way into the brain to excite the dopamine, just to give pleasure. Now, these drugs also have variants. Some drugs are hallucinogenic, meaning that they create an illusion that it's not real. So, for example, somebody that takes the popular marijuana or cannabis, as we know, or eja, as we call, or weed, as many people may call it, it creates what we call hallucination, in the sense that they can begin to hear things that don't exist, they can begin to see things that don't exist, or they can begin to feel things that don't exist. I remember some time ago, I saw on WhatsApp a man that killed his son because he thought it was a rabbit, whereas it was a son that he was hitting with a stick. That is what substances can do for you. So yes, it can cause it. Then another example is another popular disorder that is also very difficult to treat is personality disorders. People that have what we call antisocial personality disorder, or people that have borderline personality disorder. Now, these are the people that we call louts in Nigeria, on the streets of Lagos. People that when they do things, they don't feel remorse. They feel entitled. They feel they have to use force or an aggression to achieve things. They feel that being on the high negative side is what makes them cool, or what makes them acceptable in the society. Like, that popular word that people use, oh, I'm cool, I'm in vogue, you are obsolete, something like that. So those personality traits have very high correlation with substance use. That these are the people we popularly refer to as, in Yoruba, we say, Aomota. But not all of them are actually Omota per se, but because they possess certain personality traits. That is why. Now, what does this do for them? They always want to be on the antisocial part. If the government says stand, they want to sit. If the daddy says sit, they want to stand. And anything the government acknowledges as antisocial or against the laws, that is exactly what they want to do. And for those that have the borderline personality disorder, They don't have to be on the streets. They don't have to be loud on the streets, but their personality naturally predisposes them to risky behaviors. You have some people that they just always take unnecessary risks. When I mean unnecessary, there are some risks that are necessary, right? But these are risks that does not make sense. For example, a girl dating multiple men just to get satisfaction or pleasure, or an individual going into substance use just to get satisfaction. And we also must know that we are in the era of speed. You know, in those days, the process of going to the kitchen, cooking, it gives you minimal pleasure until you eventually eat the food and you feel that full pleasure. But in these days, nobody wants to go through those processes. So we are in the world of speed. There's speed internet, there's speed life, there's speed money making, and so on. So also in pleasure, when it comes to gratification, in those days, we used to delay our gratification. When you have sweets, parents will tell you, wait, don't eat it until tomorrow, or don't eat it until 2 days time. But everybody was to satisfy their urges at that point in time. So one of the fastest way to achieve this is to take substances. So because of that, people develop other mental health problems like depression. Another thing is some people also go through life challenges and they don't know how to cope because nobody is helping them to cope. There's limited social support. Maybe somebody lost his job, lost his wife, lost his home, probably used to be a millionaire, and suddenly he has not even one kobo in his account. And he's trying to survive with life, but it's difficult because there's limited social support. So there's a tendency such a person may want to resort into taking substances. Now, this is not justified. It is not justified, but because such people may know little about how to seek help. And we also have this very poor mentality in Nigeria, even though things are changing gradually. But we still have that poor mentality when people don't want to seek support from professionals. They will say, when I'm not crazy, why do I need to see professionals? Whereas even when you're going through social problems, you need social support. Now, I hope that answers the question. Thank you.
Thank you, Ma, for the answer, for the scholarly answer. Thanks. Then the next question goes to Professor Oriagba. Prof, sir, how well do Nigerians' current drug law align with medical realities of addiction and rehabilitations? Prof, you have the floor. You can unmute your mic.
Thank you very much for the question. This is an interesting question because it has a lot to do with prevention, and it has a lot to do with the addiction and the substance use disorder that we find all over the place. The drug laws are there and they are meant to be enforced. But unfortunately, most of these laws are just there. They are not being enforced. Starting from the area of access to controlled substances, access to substances of abuse. A lot of substances of abuse gets to the wrong hands, either deliberately or inadvertently, but a lot of it gets to the wrong hands, despite the laws that are there, which stipulates that they should only be handled by the experts. But what do we find? Smuggling abounds. And despite the role of the agencies, the relevant agencies, this has not stopped the problem of smuggling. And it's legal and available, and they get to the hands of the experts. You find out that some of these healthcare providers themselves can actually become addicted. I remember a very pathetic case of a nurse who was visiting our community pharmacy at that time, and she had a prescription for her mother for pentazocine. Pentazocine is a narcotic drug which is very good for pain. Now, she is a qualified nurse, and of course, she should know better. And of course, she was using it for her grandmother, as she claimed. But we realized eventually that this nurse was actually abusing this substance. She was actually taking this substance because she was coming more frequently than expected. And we became suspicious until we made our investigations and found out that she was actually taking the substance. What am I saying? We have the laws, yet you find that even those that should implement the law can also be culprits. And it's not only the healthcare providers, the agencies themselves, some of them are compromised one way or the other, and they allow this evil to be perpetrated. Apart from that, we have the lobbyists, that is, the manufacturers of some of these substances of abuse. For example, the tobacco industry. The tobacco industry, they market substances of abuse. They market tobacco. And they will do all that is necessary to evade the law, to lobby the governments, to lobby the lawmakers to subpedal on the law, on implementation of the law. Can you imagine a substance of abuse, tobacco, being taken openly by youths? And the only thing you will find is that they will just tell you that this substance is liable to, or youth people that take this substance is liable to die young. But if you look at the negative impact of tobacco in our society, particularly among the youth, it's terrible. It is the starting point for addiction of greater substances of abuse. And yet, the lobbyists have ensured that the laws are compromised. The implementation of the laws are compromised. So, the preventive aspect of it, whereby you try to limit access to the drug, is being compromised, it's not effective. Then for people that are found, are caught taking these drugs of substance of abuse, they are not given the strictest of punishments. You can just hear 5,000 naira. These laws are obsolete for some of these substances of abuse. So we need to revise the law. We need to review the law with the intention of saving our youths, saving the lives of our youths. On a daily basis, these youths are being entangled by these substances. And it's because we don't have strict laws. And the laws that we even have are not being enforced in the different ways. The preventive, the ones that affect those that are caught taking the drugs. So we need to do a lot to ensure that these laws are properly updated and then enforced so that we can save the lives of our youth. Thank you very much.
Thank you, Prof, for the answer. In fact, recently I noticed there is one they used to say in Yoruba language that I just heard of it recently. Because sometimes you see some of these youngsters around the age of 18, 15, they will buy bottled water, they will buy a full Ragolis water, they will mix it up with cough syrup. They will now add some other substance to it. It's like maybe they're going to buy some substance from those people that sell all this belebe or dry gin. They mix it up, and by the time somebody take it, you start to misbehave. They will now say, "Oh, the person started to fall down." And even though sometimes recently now, when there's an organized event, a party, you see people, they will even display it. You just see herbal water on the table, and they start to do the mixing, and nobody's checkmating them. So that is one of the issues we have when it comes to the issue of the law. Now, in line with that, I want to go to Professor Sulaiman, that how do peer dynamics and school environment, popular culture reinforce or discourage drug experimentation? Because like the example I cited now, it's just like they are experimenting all kinds of drug abuse uses among the youth, even within the secondary school. Some of them, when they're coming from home, there's even one, there's a mixture now. I think that one, they combine it with Gary. I don't know. So they do a lot of experimentations among their peers in school, in party and the likes. So Prof, how do peer dynamics, school environment and popular culture reinforce or discourage drug experimentation among students? Prof, you have the floor. Prof. Sulaiman.
Thank you very much, Dr. Bamiru. You have said it. They do it in the open, and nobody says anything. And that is it. That is the cultural thing that we are lacking. The Ubuntu thing, the interconnected responsibility. The Yoruba saying of Igba enikan lo nbimo, Igba eru lo nbato. That cultural identity, we've lost it, the interconnected self. We have chosen to go and imbibe the independent self. Usually, when adults are around where they are doing those things, they will caution them. That was our culture. They will ask them, what is this? What are you mixing? What is it for? If it is parents that knows what is for, immediately you collect it from them, pour it away, get other people around, and they will discipline them even without their parents' presence. That was our value. That was our culture. That was what we knew. But unfortunately, it has eroded us. You dare to do that, you will meet yourself in the police station. You could be arrested, and many things, unimaginable things, could be done for the person. Because this is an Islamic environment. And then we should be able to say, oh, among the Muslim community, when there are Muslims, it doesn't happen. But unfortunately, can we say that would not happen? We cannot. We cannot, because even in the people will come and display anything, and nobody will say anything. Nobody says anything, nobody checkmates them. And that is what we have to go back to the basis. Is the challenges for each and every one of us. We are all in it together, and we must all take up our guards. And because when we close our eyes and we say, sometimes there are things we always say, kokowa, but it's in our society. It will definitely, what goes round comes round. It will definitely come out, because our kids and every one of us, we are in that society. And like my brother Sheikh have said, we have to, and it comes back to the table of the Sheikh and each one of us on the mimbar. They have to continuously, it doesn't have to be only the sunnah, the hadiths, but the values, the cultural practices that we still have to uphold and ensure that they are imbibed. That is what we know education, traditional education to be, is a transmission of knowledge from generation to generation. But we are not transmitting this knowledge again. We have failed, all of us, in transmitting it, because it doesn't have to be my household alone. We are concerned, even I know that Islamically you don't take care, you are obligated to 10 houses to the right, to the left, and that was the hadith. So that is one big challenge that we have. We need to go back to the basics. We need to go back to that major culture of not ignoring. And then they are talking about the laws. It's still the same. Who are the lawmakers? Who are the law breakers? It is still all of us, parents, individuals. We are the ones, a police is among us. It's still that Khairat, that Nuruddin. The NDLA and all of that, they are all. And one big thing that is a point of correction. I am a counseling psychologist. And so one thing the school will always resolve to is, let's dismiss them. And my own point is, when we dismiss them, where do we send them back to the society? So rather than dismiss, The school should try to rehabilitate them. And I am more of a preventive counselor. We prevent more than cure. Let us stop the problem from happening ab initio. In the first place, let's stop this problem from happening. It's not just the responsibility of parents, but every one of us, because we are all in it together, and we have to stand up to say no to this. And by doing it is for all of us to have one voice. All of us having one voice, saying no, condemning it, following up together, and ensuring that our kids are not using it. We don't close our eyes to it and pretend that we don't, it's not. Yes, they may not be your kids, but how be all your grandkids? They could be friends of your kids. They can meet somewhere else that you never knew. So is not excluded is our community, is our concern, is our collective responsibility. We all need to take up our guard and then go back to the basis. We don't need to close our eyes to it. We must imbibe that culture of saying no to whatever we see that is wrong and pushing towards correcting it. I think for now, that's what I'll say.
Oh, thank you, Prof, for the strong submission. When you mentioned the issue of the Ubuntu philosophy is usually the African philosophy of togetherness on the issue, generally the concept of togetherness. And then if we call our mind back, we are going to realize that even in Nigeria, we have this principle of collective parenting, where you know that even there are some old men in the house, those retired old men, they will be reading newspaper. And they will now put the eyeglass in a kind of way that as they are reading the newspaper, they are using one eye to read the eyeglass, they are using one eye to read the newspaper, another eye to watch children around. If you misbehave, some of them, they are retired officers, some of them, they are teachers, so they are around you. So even though if your parents, if they are not around, you are in the safe hand. The environment will take care of you because of that spirit of togetherness. But today there is a cultural shift in the way we behave. I've even witnessed a situation where, because an incident occurred to a student in a school, I was even in the school, some set of students, his colleagues, and even parents and brother, they organized hooligans, thugs, to come and invade the school. It was a very serious issue. We have to shut down the school for that day for about almost a week to beat up the teachers, to beat up all the teachers, both the principal and the non-teaching staff within the school. This shows that. Then the question is what the issue of collective parenting that we have in our Yoruba culture, in our Igbo culture, in our Hausa culture, where is it? The issue of the Ubuntu, the togetherness. So it calls for reflection for each and every one of us. The next question goes to our Sheikh Said Salman on how can religious teaching and value counteract the beautification or glamorization of drug use often seen in the media. Now, if you look at the media today, we are going to realize that even though if it goes on YouTube, you see the way people they beautify use of some of these substances in various ways, and some of these youths, secondary school students, primary school students, they now have access to internet. So, for you people in the religious arena, we are not shaped, we are not religious leaders. How can you assist us to counteract the effect of the media on drug use within our society? You have the floor, sir.
Okay, thank you very much, my brother. One, I want to start by saying that it is not possible to appreciate religious teachings if everything is restricted into the mosque. So, which means the religious leaders, our existence should be felt in the media. Our existence should be felt in social media and what have you. So in that wise, all the teachings that Islam has for us on the issue of this substance taken and what have you, we'll be able to disseminate it. Then also, there are some ideas we need to rebut. But if you are not there, you won't be able to profile alternative that will take people away from such. Let me start by saying that one, there are two things Islam attaches importance to them. When you talk about Maqasidu Sharia, and what is Maqasidu? That's the reason why Allah subhanahu wa ta'ala gave us Sharia. One is hifsu and nafs, to protect the soul. Whatever that to lose your soul, Islam warns against such. That's why in the Holy Quran, Surah Al-Ma'idah, that is Quran 5, verse 90, Allah talks about intoxicants. You are not expected to take intoxicants spiritually and also for your own health, healthy life. You need to move away from it. Then also, Prophet Muhammad Sallallahu Alaihi Wasallam says that whatever that can intoxicate you in large quantity, automatically the small quantity of such person is unlawful for you to take of it. So in Islam wants us to protect our soul. Then also, hifdul aqil, that is to protect our intellects. And if you look at this substance we are talking about, it starts by turning the intellect to another thing entirely. You'll be living in fantasy worlds. What is not real will appear to you to be real. So Islam wants us to protect our intellect. So this is the first thing we need to let people understand. When you're talking about Islamic Sharia, it is not only about amputating, decapitating, and what have you that Sharia entails. Then we move to alternatives. Alternatives. If you look at those people glamorizing these drugs and what have you, they made films, short reels, and what have you. As religious leaders, we should be able to make such to let people understand the fact that if you engage in this is the repercussion negatively now. So if some people are glamorizing drug, look at the person who engages in such acts and look at the repercussion. So we should be there to counter those ways by which these, should I say, the destroyer of humanities, they are introducing drugs to people. Then also, we should be able to create a positive lifestyle campaign. That's why I said our teachings should not be restricted to the mosque alone. Our presence should be felt in all platforms, social media platforms, then also in the media. So in creating this positive lifestyle campaigns, we have something like talent shows. It is not restricted to some people. So as Muslims, we can learn from it because our religion taught us that whatever that is good, we are advised to learn to borrow from such forces. So you have that talent show. Then also people engage in sports. Then during the festivals, you let people understand the fact that there are other better things you can engage in them without taking the substance. Then also, religious leaders, we must acknowledge the fact that people are undergoing many things. The struggles, we must appreciate it. We must acknowledge it rather than presenting them as if it's over. We shouldn't use that approach. We must appreciate the fact that we know people are undergoing this, but there are solutions to things. This is how religious leaders should present this issue. Then also, we should monitor the trends in the media, social media, and what have you. We should monitor the trends by which these people, glamorize, beautify drugs. And we should be there to rebut all these approaches with concrete evidence. So that's another area the religious leaders are expected to use the teachings of the religion to address the issue of beautifying drugs. Because if you are not there, you won't be able to tell the people that this is what religion has in terms of you living that drug. Because people usually appreciate what they see. So if the religious leaders are there also to present to them that this is an angle of religion to this issue, automatically people will appreciate better that, okay, there are alternatives to what we listen to every day. So this should not be the way to go. Rather, there are other ways we can go in order to live a healthy life. So I want to believe if these religious teachings can be disseminated appropriately and correctly, automatically it will lessen and it will, to a large extent, ameliorate this challenge of substance taking in our society. But by and large, the religious leaders need to understand that this can never be achieved if we restrict ourselves to the four walls of the mosque. We should engage the community. We should engage the society in order for them to appreciate more the content of religion, especially Islam as a religion. Thank you very much.
Thank you, sir, for the answer. Which, and in fact, it's very, because based on your response, it shows that religious leaders need to move out from the mosques, either from the church. You need to collaborate with other agencies, people from the medical arena, so that we can have an holistic solution to the problem at hand. Thank you, sir. So the next question goes to, before I call Dr. Aroye for the next questions, this program is being live streamed on our YouTube channel, and we have about 1,000 plus subscribers on the YouTube. We are live streaming the program, and also the communique of this discussion. It is our tradition at Muslim Lecturers Association that the communique of this discussion we are having today will be published in national dailies and other social media outlets for people that are not around to be able to consume it, and also we also give it to we also use it as an opportunity or medium to pass it to the policymakers so that they can look at how they can adjust some of their policies so that we can all live in sustainable happiness. Now, my question goes to Dr. Aroye. Dr. Ma, are Nigerian rehabilitation centers adequately staffed with psychologists and mental health professionals to provide holistic treatment? Ma, before you answer the question, Prof. Odeagba, when I'm going to ask for your contribution on this question as regard the medical aspect, we also have medical facility and expert when Dr. Aroye is done with his own response. Dr. Aroye, you have the floor, ma'am.
Okay, thank you very much for that question. There's no country in the world that has adequate staff. There's no way, even in the US, they don't have adequate staff because of the way the world is rolling right now. It's internet based. Everything is technology. We have industry 5.0, upcoming 6.0, and so on. So, like I said earlier, if you want, it's a world of fast pace. So because it's a world of fast pace, so many psychological problems are emerging. Things that were not problems before now are problems. Things people could resolve through their resilience and self-control becomes impossible to achieve. And like I said earlier, some people go into substance use as a coping mechanism. So there's no part of the world that has adequate staff, but some countries do way better than Nigeria. Some countries are doing way better than we are. For example, in the case of staff, like we're talking of buffet, we naturally have this hierarchy problem in Nigeria where the medical doctor naturally assumes that is the boss of everybody. But in the real sense, in international world, everybody is the boss of themselves in their own field, meaning everybody plays an important role. As a medical doctor, you play an important role. As a nurse, you play an important role. Dietitian, you play an important role. Also, facilities. Public facilities are not well funded. Even the politics in Nigeria is not well funded, much less facilities that has to cater for mental health care. And even private sectors are afraid of inpatient treatment. Why? Because most substance abuse cases can be violent, and sometimes some of these patients can run away from the clinic. So many people want to take to public facilities, but even if public facilities do not have enough hands or enough therapists or psychiatrists or nurses or dietitian or nutritionists or counselors or OTs to cater for their needs. So we also have that problem. Aside funding, we have that shortage of staff. Then we also have we have what we call the reversed knowledge. Staffs are not being trained on updates means or update ways of addressing this issue. And some of the facilities, like for example, I remember many years ago when I was doing my posting at one of the psychiatric hospitals, they were using a particular tool which was developed in 1989. So when I did my PhD, I got the one that was developed in 2011. Now we have one that was designed in 2025. I'm sure many of these hospitals still use the one of the 1989. So some of this updated information or knowledge are still lacking. Now, it's not the fault of the individuals, because there should be enough funding that should cater for their update training. We have private sectors too, but they are very expensive. We still, and of course, many people in Nigeria still patronize, I don't know how to label them, but I'll call them the traditional healers, where you see, I remember a few weeks ago, one of my clients reached out to me. He used to have gambling addiction, but now he started taking substances. And he reached out to me. He did a video call and he was in chains. His hands and his legs were chained. And that was just the treatment method. Yes, they tried to detox, but by chaining them, that may just be an old way of treatment. So, of course, after you detox them for 2 weeks, they don't feel, they are unable to move, they are unable to do anything. After 2 weeks, that withdrawal symptoms or that urge to take the substance will naturally emerge, and they are likely to go back to take it. So treatment methods are still kind of obsolete. I know that so many associations like Nigerian Clinical Association, Clinical Psychologists Association are doing their best to upgrade, but still, they're still lagging. We all are still lagging behind. Then also, it will also require holistic treatment. Now, many of our hospitals, some of them still work with biopsychosocial, but in the recent time, it is no more biopsychosocial. It is biopsychosocial, spiritual, environmental treatment, in the sense that you must bring in the religion of the person and you must bring in the values of the person. Hence, I agree with what Professor Hairat mentioned about going back to who we are. Now, there's a confusion between who we are and what the society expects of us. And there's a deliberate mission to distract the youth. Okay, so if the youth are distracted, things will go the way the 1% of people want it to go. So one of the ways to distract them is the substance use. And of course, with this 1% of people that do not want this youth to get proper medical support or proper social support, many of these facilities are still obsolete. So if there were to be an adequate facility, then they'll be looking into all the components of the patient, not just giving the patient's medication or not just seeing the psychologist, but also attending to their social needs. Some of them, like was mentioned, some of them need spouses, some of them need money, some of them need jobs, some of them need to move completely away from their environment, to change friends. So you need to address all those factors, as they come or as the clients would need such. Then another very important thing I also like to add in this case is that in Nigeria currently, aside going to the psychiatric hospital, yes, there's that popularity for clinical psychologists now, which is good, and for counseling psychologists, good. But there's that most of the time they all go to psychiatrists, which is also good, right? But then aside the psychiatrist, the policy that guides the treatment and the policy that guides the prevention, just like was mentioned, are obsolete. Aside obsolete, are almost irrelevant. Recently, I think sometime last year or early this year, many countries had a meeting that all their policies are not working. Everything we are trying to reduce substance use, to reduce trafficking, to reduce sales, nothing is working. And one of the things that was discovered was that there has to be a shift from the perception on how we address how we address substance addiction. Now, substance addiction shouldn't be only go to prison, stay there for years. Even in the prisons, they still have access to substances, right? Especially tobacco. And there's this classification. We have legal drugs, non-legal drugs. Legal drugs are tobacco, alcohol, while others like like heroin, like morphine. Even some of the morphines are even legal for medical use. So, but then some people abuse it. So one of the things that was discovered was that policy plays a very big role, and facilities and harm reduction facilities plays a very big role. Though when it comes to harm reduction facility, I have my my philosophical bias because I'm a Muslim, but certain aspects of harm reduction facilities plays a big role. So when the conventional facility is not functioning in Nigeria and the conventional handlers are not getting enough support, they're not hearing enough, like we see many professionals are leaving Nigeria, going abroad. Obviously, it goes back to the society. So when the way it goes back to the society is that those that are seeking support are likely not to get proper prognosis for their addiction, and eventually those that are yet to seek treatment are probably not likely to go to seek treatment because even their colleagues are not getting the treatment they need. Wala wala.
Thank you for the response. Prof. Oreagba, we also need your contribution on this as regard do we also have medical facility, medical personnel? Are they adequate in addressing or in combating this issue, looking at the statistics that we have and the numbers of youth that is having this issue? The floor is yours, Prof.
Yes, thank you very much. And I thank my sister for that wonderful contribution. The medical personnel, the medical facilities are grossly inadequate. And you can see the exodus of medical personnel from Nigeria. It's happening on a daily basis. The Japa syndrome seems to have come to stay. The doctors, the pharmacists, the nurses, physiotherapists, psychologists, all the various levels are leaving the country in worse. And that even makes the situation worse. How do we address this? We did a the trainer workshop some years back. That is the Islamic Medical Association of Nigeria. We knew to get to this level. And we felt that we should be training not only our colleagues in the medical sector, but we should ensure that we also train other stakeholders, starting from the parents. So we have workshops specifically designed for parents. We have workshops specifically designed for the clergy, the imams, the pastors. We have workshops specifically designed for students who will become peer ambassadors in their various schools, right from the primary school. So these are strategies to help to mitigate the worsening problem, which cannot be handled only by the medics, the medical professionals. Everybody is involved. And for you to handle substance abuse successfully, you must be trained. If you are not well trained, you might not see the impact of the problem and the strategies to mitigate it. Imagine a youth who is not aware, who is not enlightened about the problem of substance abuse. Such a youth can be easily lured through peer pressure. Now, compare that with another youth that has been trained, that has been enlightened. Such a youth will be a positive peer ambassador and will be able to discern the minds of vulnerable youth. That is just one. Look at the parents, for example. Many parents don't even know what to look at in their children. They believe their children are okay. My children goes to the mosque, my children prays, my children is this. You don't even bother to do some search. Suspicious, what we call spontaneous search at certain times to monitor their movements, to engage them, to actually think of what exactly is my child thinking about. Does he have any problem? How can I engage them? Do we really engage our children? Do we really try to address their needs, apart from the running all around to cater for their school fees and the rest? These are some of the strategies that we use to ensure parents are also well enlightened, because it starts from the family. If the family is not well orientated on substance abuse, then that child may be gone forever. God forbid. So the way in which we try to mitigate this problem is multifaceted. We can see that the medics are leaving, then we must look at other strategies. And one key effective strategy is that education strategy, capacity building for all stakeholders. And with that, we can monitor and ensure that as many people as possible are given that right education, and they can also educate others near them. Imagine an individual who is well knowledgeable and well trained in a family. That individual can actually train the family, and you have saved potential lives in that family. So that is the strategy that Women is adopting. And we've had workshops with over 1,000 trainers. And we are continuing in that, because as we are trying to make that impact, the lobbyists are also fighting. They are not sleeping. So it's a serious war that is going on. And inshallah, we will succeed.
Thank you, Prof, for the scholarly response. Now, the next question goes to Prof. Sulaiman. Prof. Sulaiman, what role should family play in shaping attitude and resilience towards drug use? Because I could remember that I think when we were very young, there is this Yoruba stories they would read to us. For example, kini ma fò lè ṣe láyé tí mo wá, kàkà kí n jalè má kúkú dẹrú. So during that period, when we are very young, that attitudinal teaching, sometimes we have that mind, mo gbọ́dọ̀ jalè, I should not steal anything. But now we have the opposite. We now have a situation where the parents will even fight the government, or we even protest that they should allow their kids to become Yahoo. Even recently, it was when I traveled, that was the first time I have access to, I could see people taking electronic cigarettes. But maybe 3 weeks ago, there's a supermarket at the front of where I live. When I went to purchase something, and then at the point of exiting the supermarket, I realized that some youth, they were taking that electronic cigarette. So, Prof. Ma, how can family assist in shaping the attitude of our youth so that they can become the leaders of tomorrow?
Thank you very much, Dr. Bamiro. Like, as a rider to what I have said, the family, although is the smallest unit of the social organization, and that is where the child is built. The foundation of whatever a child is taken into the community is built. But unfortunately, like you said, you have seen, that thing that you are saying electronic is not just new, it's been there. They call it shisha, shisha. You see the way they share it. And what is coming out is that it's even more dangerous than the one that, because it goes in. And what they have done is they've given it different flavors. And they think it's smoked by women, and even married women. Even, it's becoming unbecoming. But the truth is that it's not the job of the family alone. Like I have said before, it is enough for you to train your child, but when he or she goes out, what do they need? We are now living in a society that is different from what we used to know. I'm talking about almost 15 years ago, is this when I had this shock of the training at home. When I was training, when you are training, you are busy at home inculcating, imbibing this culture in your child, and he goes out and comes back to tell you that even professors like you, they came to that gym center now, they came to come, and I saw one so person in so university that came, and it was the so. And the spirit of me waking up my child to say, why look away? Is that you see? So the truth is that yes, it will require a very strong self-control, and really very, very, very strong assertiveness for a child to deal with the challenges without the support. So the thing is, right back at home, we continue to give them that support. We understand, because for me now, I actually empathize. I actually empathize with the children of these days, because in our own days, we are all, there is that communal, there is that, like I said, that Ubuntu was there. You are being watched by everybody. It's not just your parents. So it's not the duty. But these days, when you are busy training your child, when they're busy, like Professor Oreagba mentioned something, they go to madrasa, they go to, and majority of us even also forgot that beyond going to madrasa, beyond going to school, beyond going to all of those things, we still need to do a follow-up. But when you do all this follow-up, are they going to live in isolation? They are not going to live in isolation. They are going to, so it's like oraso panoso tobano baya wasupatun tia wasupabaya wesungo. If you train your children and your neighborhood, because it's not when you are living in a community of 10 houses and you are the only person sane. Because sometimes I look around to see, am I the one that is sane? But it takes me time to say, no, because this is not the right thing. But you see that the abnormal has become the normal, and the norm has become the abnormal. It is you that is covering, that is, you are doing the wrong thing. And it is the person that is naked that is right. And you see the way the society and everything praises that. And then it's challenging. I have a patient before me right now. The question is there really God? Why is God allowing all of this to happen? Do they say, and you see, the cognitive, the orientation of that child is distorted. It's becoming distorted because the hikmah she has is that you pray, you stretch your hands, and why is God allowing all these things to happen? Why are even, especially when they now meet the so-called Muslims there, especially the so-called ulamas, the sheikh, the high above people that you expect them to meet, good characters with them. It's really a challenging thing. And families can still go back, ensure you put your support, your principles, the culture, the Yoruba, roti omoeniti wonshe. Remember the child of who you are. We keep singing that music to them, but it goes beyond the home alone. It's from the home to the school to the community, like the training that they said is not just. And I want to believe that the imams, the sheikhs, has made, because for the Christians and even some major also Muslims, it is whatever their sheikh have said. My imam said this. Some of them don't know the hadith, they don't know the Quran, but imam so have said this, and that is it. So I think, like Sheikh Ustaz Salman has said, it is a challenge for them, because the mimbar also has to be used for that. Let the parents, let them be aware of what is in the society. And we should also follow them. Majority of the people we keep, I want to seize this opportunity to also say it, that we keep saying, don't be on the internet, don't be on the TikTok, and that is where all the actions are. For me, as a counselor, the mother parents has to be cutting edge parents. You have to be there with them. If you don't know the slangs, they come up, they take the slangs, and you don't know it, and it's happening right there in your nose. So you have to read about it. They have to be educated about it. They have to have the knowledge of what is going on. What do they call them? What are the terms for it? So that it is only when you are knowledgeable about it that you will be able to correct, give there are times you say it and they say, and that is an opportunity to educate them about it. But when you as parents also don't know about it. So we have to be there. You have to be cutting edge parents. You have to be there with them. Be on the social media, be on the wherever they are, be there with them, be their friends, move with them. So that you'll be able to know what is shared, you can even, for me, I disguise, I can be there as not my name, not my picture, not I'm a friend that has just clicked. And that is how to go about it. We have to always be there with them. And it's not only the home, and it's a collective homes. When we all, it is for us to speak with one voice. Is when they now go out and they are hearing the same thing, because we all come from homes. When we come to that madrasa, to that community, we are from different homes. When we come with that zeal, without voice of no to the drug, no in everywhere, in the church, in the mosque, in the media, then we are beginning to have a collective voice. But when the homes are doing it and some homes are not doing it, and the society remains what is it with the 1%, like they said, and they are more stronger. So we really have to also be stronger, not be we won't let off our guard. We won't let's say we are tired. We won't say we are not doing it. We almost speak out, pick up our roles as elders in the community, wherever you are, even if they are not going to hear they're not going to do they're not going to do your bid, but let your voice be heard. And that is what we are doing here now. We are saying it, trying to push it out that this is going on, and for us as Muslims, we know it is there. We are not closing our eyes to it, and this is our resolute about it. May Allah make it easy for all of us to be able to stand up to that responsibility and that challenge, because it's a collective one that we all must face. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you, Prof. Ma, for the strong submission that there is need for us to make use of our family philosophy or family value. We need to entrench that value in our children so that they understand that in this family, this is our value, this is what we stand for, and this is what we represent. The next question goes to Sheikh Said Salman, and the question is, what specific role should faith-based institutions play in rehabilitation, counseling, and value reorientation for substance users? What specific roles should faith-based institutions play in rehabilitation, counseling, and value reorientation for substance users? Sheikh, you have the floor, sir.
Thank you, my brother. I want to start again by saying that, because if you look at this rehabilitation, counseling, and value reorientation, looking at these three issues, it will appear to some people that religion has nothing to say about it. It may be relevant when you're talking about other religion, but when you talk about Islam, everything is well encapsulated in Islam. A good example, look at Prophet Muhammad sallallahu alaihi wasallam. There were several companions. Some were idolaters, some were sinners, thinking that as a result of this sin, I've been condemned. But Prophet Muhammad sallallahu alaihi wasallam welcomed them, empathized with them, then guided them to the right path, to the extent that when you talk about high level of spirituality, you mention many of them. So I have 4 things I want to give advice, that if religious or faith-based institution can put them into practice, it will really assist to rehabilitate. Because when you think about rehabilitation is that to take those people back to their normal self. Someone who have been taking substance, is addicted. We want to assist him. Then we want to counsel him, not to condemn him, and not to judge in any way. Then we want to give orientation to know that there are better things we can do as human beings. Our duty on Earth surface is to make positive impact, not negative impact. So the first one is that we should try to establish a faith-led support groups. You know, those ones that are doing fine and they have been guided properly. So if you establish those support groups, that is peer recovery groups, model on evidence-based approaches. It is not on conjecture. You know, people usually believe the religious leader. And whatever you want to do, it should be evidence-based. When Professor Sulaiman was talking, she made mention of one thing that people believe that whatever my religious leader says, that is the final. And at times, some of these religious leaders, they are saying some things that are not evidence-based issue. We must consider this. So that's why I said the first one is to establish a faith-led support groups, peer recovery groups, model on evidence-based approaches. What does the Quran say about it? What does the Sunnah of Muhammad Sallallahu say about it? Our predecessors, our early scholars, what do they have to say about that? That's number one. Then number two, we need to train ourselves. Even the imams, we need training. That is one of those things I do tell my friends who happen to be a Christian. A pastor will refer to himself as a counselor, whereas he has never been a student of guidance and counseling, and yet you refer to yourself as a counselor. No. There's a difference between being an imam or being a pastor and a counselor. A counselor is a professional. So that's why the second thing we can do to achieve this rehabilitation, counseling, and reorientation is to train our imams, the chaplains, in addiction basics and confidentiality. Confidentiality is one of the principles of counseling. So we need to train our imam. We need to teach our imam. And the pastors as well, we need to teach them what we mean by the basics in addiction. They are not professional. Rather, they need to have one or two things about what they want to do so that they will not goof when they are doing that very thing. Then we should be able to create transitional housing or halfway program with skills to train those who involve in that activity. And the last one, we should formalize referral network. You are an imam, you are a religious leader, you should know your limits. So that referral network should be there with licensed clinics, psychiatrists, and social services. So immediately you call them, or they receive your letter, they understand that, oh, this is Imam Lagbaja, and this Imam, we know him that he has been doing fine in this area. So those are the things I think if we can establish this, we'll be able to use faith-based institution to achieve that rehabilitation, to rehabilitate the someone who has addicted to substance, then also we're able to counsel them, and at the end of the day, we'll be able to give them orientation to live a better life on Earth service. Thank you very much.
Oh, thank you, Sheikh. Thank you, Sheikh, for the response. The response is the top-notch response. Thank you, sir. When you mentioned the issue of confidentiality, is really an issue. That is why even some people today, they find it difficult to provide some information to some religious leaders on the issue of this confidentiality. Because some people find you may see yourself as a religious person, but when you are not trained on the basics of that issue of confidentiality, you may not understand that patients like that or people suffering from the issue of substance abuse, information about them need to be secrecy to a certain extent. The next question goes to Dr. Aroye. Dr. Aroye, what innovative psychological or community-based intervention could strengthen policy efforts to curb substance abuse? What innovative, either psychological or community-based intervention could strengthen policy effort to curb substance abuse? You can unmute yourself, man.
All right. Thank you very much for the question. Um, Before we can be innovative, we have to have the fundamentals, right? So I think the first of the one of the basic thing is making sure that the fundamentals itself are available. Like we said earlier, there's proper facilities, there's proper funding. The government acknowledges, many governments of many countries of the world who publicly acknowledge the rise in mental health, rise in substance use, rise in drug sales. Aside from, well, I stand to be corrected, but aside from the news we get to see by NDLEA arresting people for drugs, it's not like we actually get that outright follow-up from that. So I think the basics has to be in place before we can be innovative. So the basics on policies too. And when it comes to policies, it's robust. Like we said earlier, it's not just address punitive measures. There has to be therapeutic measures. There has to be familial measures. There has to be financial measures to resolve this. And those measures would then be innovative if they fit the time and space we are in right now. So I'll give an example from Australia, one of the countries that are able to address some of the issues, especially on tobacco and some other drugs. Number one thing is, one of the innovative things Australia did, aside, we know these countries are well equipped with digital technology. So of course they incorporate that and they are able to pursue and monitor all their policies. So one of their policy is that there is a time of the day you can actually buy tobacco. Unlike anybody can walk into Mama anytime, or in other countries, they can just walk into any shop and buy cigarettes. So one of their innovative policies is that there's a time of the day you can buy cigarettes, tobacco especially, and of course other legal drugs like alcohol. Number two is when they monitor the sellers. All sellers are registered, so they monitor the sellers. If any seller buys, sells some of these products at the wrong timing, they arrest the seller, not just the buyer, right? But they arrest the seller because the buyer would not be able to buy if the seller did not sell. So sellers would also be careful and want to stick to the rules. Another policy they came up with is that you have to be 18 and above to buy. We know so many people claim to be 18, they could use fake IDs, but the IDs can be verified now. So the moment the seller is verifying the ID, it goes to the database. That is them incorporating digital technology. It goes to the database and they are able to confirm. So if anybody is bringing in a fake ID, of course, nothing will go to the database. So by the time, by the end of the month, they come to review how many people came to buy tobacco, who are those, and by the time they realize that, some of these IDs are fake, they can always trace them. Okay, so, and also other measures are rehabilitative measures, just like some other countries, for example, Malaysia, when they arrest people for trafficking, especially drug use. For trafficking, Malaysia is one of the countries that still upholds capital punishment, even though the last time they did it was in 2017. But then when it comes to arresting people that take drugs, they don't just put them in prison. They have to go through a compulsory 2 years rehabilitation program for substance use, meaning that if you are arrested for taking opioids, you must go, while you're in prison, you're also registered for a 2-year rehab program. So this goes pari passu, and because Malaysia is a Muslim country, it is usually religious incorporated, and to a good extent, they have very positive results. So other than that, there's also digital use for contingency management. We now know that the age range has dropped. It used to be 40s, 70s, 50s, and 60s, but now we have 10, 11, 12. So our policies and our innovative mind, which brings in researchers, which brings in religious leaders, which brings in parents, which brings in the education sector, and so on, would come together to define myths outside the original things we do. When we see someone take drugs, typically we label them, we probably talk about them. Like that is taking drugs. Did you see? Do you know? Blah 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 blah. But now one of the innovative means is making sure that those individuals are actually addressed based on their age range, based on their cognitive capability, based on their environment and their financial standards. So we also have social norms and campaign. I think this had been addressed well by all the speakers. We have to go back to who we are. It's typical of us now because of our education and social media. We have a typical Nigerian girl who wants to live a life like an American girl. It's impossible. You still have that cultural gap. So because parents themselves are not taking responsibility, we are moving away from our social norms. So we can't just bring in the ideology from America and drop it in Nigeria as a policy. We have to conduct research and understand what fits, what is our round peg that fits our round hole. So that's very important. And we also have social capital. This takes us back to training of our expertise and also encouraging. I remember when I wanted to study psychology, many people discouraged the course because some people thought, oh, you will not make money from psychology. You know, in those days, people wanted to be doctors, lawyers. So, but now it is shifting. So if we now have to encourage, because we need that social capital base, right? We need that skill. We need those skilled labor. We need those skilled knowledge and so on. So we might need to encourage more people to go into professions. That, I think this is just by the side. Psychology is not going to be one of the courses or one of the professions that AI will take away. Yes, we incorporate AI in treatment, but of course, that human touch is still very much needed. So we also have to do that. Then also, we have to go back. We can also incorporate virtual reality, telecommunication, so many adverts. Even though we see adverts on the screen saying smokers are liable to die young, we should have counter adverts. And also, of course, it requires funding. But this also takes me back to what I've emphasized, that it's a deliberate measure. Like we have to see substance use and it's a conglomerate, right? Substance addiction, substance use, substance sales. It's a big business. It's an industry on its own. Even though we may not want to accept it, but it's a big industry. It's just like when you sell rice. You want to come up with innovative ways, ingenuity ways to sell your product. So that is why we see that people now lace drugs in candies, they lace drugs in cookies, they lace drugs in drinks. There are so many ways they are trying to get the youth. So if we have to be innovative, we have to go down and understand the mind of an individual that takes substances. Why would they want to take substance, and to what extent would they seek substance? So if we are going to counter that with our ingenuity, we have to find a solution that is pari passu with that. So it's a big business that is, in fact, the ways they sell these products can be very, very tempting. Even for children, they're saying, oh, your mommy just spanked you on the cheek. Don't mind your mommy. Don't worry. I have something that I can give you that can make the pain go away. And truly, they'll give the child something and the pain will go away. Why? Because it is laced with opiates. So there are quite a number of things we can also do as individuals. We can, as parents can stop being control. Yes, parents have to be controlling, but parents can stop being ashamed or seeing their child, for those that already have children with addiction anyway, seeing their child as omoburuku, a child that can never do well, or a child that can never. It's difficult to treat substance addiction. It's very difficult because of the craving, because of the withdrawal symptoms, because of the high level of euphoria they experience. But at the same time, when parents shift from being punitive and shifting from accepting what the situation is and looking for more effective ways to address the situation, then I think with us coming with all these ingenious ideas would definitely change the way substance abuse is addressed in Nigeria. Wala wala.
Thank you, Doctor. Now, so Professor Oriagba, this is the last question to you. So when you answer the question, can you give us a parting word or a final note that our participants or those that attended the programs can take home when you are done with answering the last question? Based on the global pharmacological practices, what lesson can Nigerians adopt to strengthen its fight against substance abuse? Thank you, Prof.
Thank you very much for the question. On a global perspective, you realize that a lot is being done on prevention. Why? Because it is a low-hanging fruit that can reach multiple societies, multiple countries. In Turkey, we have this Green Crescent initiative that brings together several countries, over 30 to 40 countries. And that is basically a way of harmonizing the thoughts, harmonizing knowledge, sharing lessons among the various countries, fighting against substance abuse. So on that global level, when we have common strategies, it becomes easier, more effective. And you can actually get funding to do plenty of this work. So the low-hanging fruit that I would recommend for Nigeria is that preventive strategy, whereby you are giving a lot of public health education, public health enlightenment, and becomes a norm. It becomes the household name. Say no to drugs. Drugs can kill. Drug is killing your neighbor. Avoid substance abuse. Because the problem of substance abuse, as was mentioned by the previous speaker, is that it's very difficult to stop it once you are addicted. Addiction goes through a phenomenon. It starts with tolerance. Okay, tolerance means that you need to take more of that particular substance for it to get the effect. From tolerance, it becomes dependence. Okay, you become dependent on it. And then from dependence, it now gets addiction. Now, if it gets to the level of addiction, then that is a brain disorder. That is, the structure of the brain has been damaged. And that is why we don't want it to get that level when it becomes so difficult to treat. And so when you do a lot of prevention, a lot of preventive campaign, you are able to dissuade the minds of so many people. And even those that are already tend towards the addictive mode, when they are able to grasp the impact and the significance, then they can reverse their fate. But if it gets to addiction, it's always a problem. An addict that has been rehabilitated for several months and has decided not to go back to drug, but because of that brain disorder, any trigger can take him to the ghettos. And you'll find him amongst the substance abuse colleagues. So my parting word is that the government should collaborate with healthcare providers, with religious leaders, with teachers. Teachers are very, very key when we talk about prevention against substance abuse. And of course, the community leaders and the clergy. They must have that collaboration. And then we must continue to advertise, publicize this problem. It's like everybody is so silent. We don't even see anything talking about saying no to drugs. Everywhere is just silent. Well, we are sitting on a gunpowder. So we must have aggressive publicity to let people know the dangers of substance abuse. It must enter our television. It must enter the radio station. It must enter the newsprint, the electronic media, and then the social media. So that anywhere you go, what you are seeing is say no to substance abuse. Substance abuse can destroy your life. It can destroy your property. It can destroy your family. When people get to see that, then the youth, when he sees a lot of this, then it will effectively counter the mirages that he sees with the celebrities who are into substance abuse, who are smoking. It will counter it. You will come back to the senses that, so it's not really cool to take drugs. It's not cool to smoke. So we need to counter many of these negative publicity by we bringing up our own adverts, our own publicity. And the government cannot do it alone. Everybody must come together and fight substance abuse. And this slogan that the Green Christians usually mentions when we finish a workshop, and we have also adopted it at the Islamic Medical Association of Nigeria, is that together we are stronger against substance abuse. Jazakumullah khairan for the invitation. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you for the submission, Prof. It's highly appreciated. Prof. Sulaiman, this is the last question for you. I'm going to read out the last questions, and also you should give us your parting word after answering the question. Now, Prof, looking at the issue of substance abuse, if you look at it today, we also had it on the high side among the university students. So the question is, can schools, maybe colleges of education, polytechnic, and schools and universities be redesigned as a frontline institution for early detection and prevention of substance abuse? Recently, I understand that our excellent First Lady of Lagos State organized a campaign on the issue of substance abuse with the leadership of Lagos State University. So we, in order to reduce the impact that is having on our society. So something like that. So how can we redesign, or how can school transform themselves so that they can become frontline agency as far as detections and prevention of substance abuse in Nigeria? Prof, you have the floor. So when you are done with answering the questions, you give us your parting word. Thank you, ma'am.
Thank you very much. Coming back to me once again. Actually, like I've said before, I key into the preventive more than the cure. But definitely the cure is there. And you are talking about now designing. No, the universities, the schools in Nigeria, especially in Lagos State, already have an organogram. They already have this as part of the curriculum. That is why in every schools in Lagos State, they have professional counselors attached to the schools. That is what the counseling school program is meant to be, is part of it. There are two organizations in Nigeria and in Lagos State that these counselors work with. And every year, yearly, they champion the cause on fighting drug abuse. There's the Youth Jamboree. The Lagos State have been doing the Youth Jamboree. Lagos Counseling Association in Lagos State have been doing the Youth Jamboree for many years. And what they do is they invite schools and they talk about, and major things that they discuss is all about sexual abuse, drug abuse. So it is there. We see in universities and higher institutions, there are also counseling centers. That is what the counseling centers are meant to do. So what we will charge them to do is to be more proactive, more responsive to their responsibilities. Because those centers are there to cater for this, to ensure that there is this education and awareness. And it's as a part of every year, there is supposed to be the school counseling program. And that program is going to include the education, the awareness, which is germane. Because it's through the education, creating awareness in every forum, both the print media, the social media, more importantly, where you can catch this youth. That's where we'll go and ensure that, especially we don't need now to, it's already in the curriculum. The essence of creating the counseling center is to ensure that all of the adjustment problems are catered for. And since whatever is, we already know that this is a challenge in the community, it becomes the major factor within the counseling program, and it's championed continuously. So it is there It is just, we use this medium to call upon these centers to stand up to their responsibility, be more proactive, be more responsive, because it is we now need to create, apart from creating awareness, they create the support, the environment, because the school, this is where it is through the counseling center also that will call the attention of the universities, the schools, to the need to create an enabling environment, a drug-free environment. We all know that as those of us who are teachers, schools, part of the requirement for situation of a school, unfortunately, this is what the government as a whole and all other organizations will have to, policymakers will have to look into. Schools in those days are not created close to the garage, close to where you know that. And once we have schools around that environment, it now becomes the priority of the school to make sure that they clean their environment. When you are creating, when there is educational awareness without enabling environment, it rendered the effort useless. Because when you tell them and you still have these people that are luring them to buy from them, if you are doing, for those who are already doing intervention, you know, sometimes you have to go to the root. Who is the supplier, and to cut the supplier before you can get. And this is where the peer support also comes in. The peer groups are also going to be used. They are going to be used in the process of educating and creating awareness. They are going to be used in the mentorship program thing. They are going to be used in ensuring that they do the monitoring for those who are already going for treatment they are for in the intervention, because they are the ones that could follow them one to one. And we also, beyond ensuring that the school, whatever the school effort the school is doing, the parents has to be involved. If the school is cleaned and the home is still in support, we are expecting parents to be the role models who will, but if they are what are they modeling at home? And that is where that collaboration that has been mentioned comes. It is not just one thing that the school can do, but yes, I want to reiterate that it is there in schools. Especially, I can say it authoritatively that part of the Lagos state government has ensured that all schools have, except it is now changing in the few years that I'm no more in Nigeria, but what I knew is that they have professional counselors. There is a standing professional organizations that are also key into ensuring this is done. And the universities also have, I'm very sure of Lagos State University, I'm sure of the University of Lagos, UNILAG, the counseling center is very strong, but are they standing up to their responsibility? And I'm also thinking, also there is the GNS courses that they are doing. It's also some of the things that are taught for the 3 years in those courses also are part of this. What we only need is ensuring that there is an enabling environment. The policies, the money, the follow-up, the NDLA are really keen about what they are doing. You go and report that this person is selling drug, and then they go back to tell them that this is the person who has told us. So that is why I've said it's not just about the school, it's each and every one of us. Once we are ready to clean, and it's about attitudinal change, it's about readiness, it's about all of us to see it as our problem, a collective problem, and not just somebody's problem. It's not somebody's problem. It's becoming a community problem that we'll all have to collaborate to come together to solve beyond the home, the school, the community, the policymakers. The government themselves must be willing to support all the organograms that are in place to ensure that at least if we are not totally eradicating, it is reduced to bareness minimum. And more importantly, idleness is very important. When students, they are 2-3 weeks, they are not being attended. They are left with those people the sellers and the recruiters to get them engaged. So those are things that are holistically needed to be looked upon. With that, I just want to say my parting shot is that we need to stand up to our responsibility. Let us go back to the basis, the collectiveness, the Ubuntu African thing, the thing. It should not be, we should not look away. It should not be some of us parents in the society are tagged as Oti Buruju just because you won't close your eyes to what is wrong. And it's important, if we all want a change, we all need to go back to the basics, to take up that our responsibility of doing collective punishment. And punishment is not about slapping them, maltreating them. It's about ensuring that they uphold the values of our community and become responsible adults. They become responsible children who grows to become responsible adults in the future. Thank you very much. Akulu kolo hadha, astaghfirullah wa lakum. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thanks, Prof. Man. Really enjoyed the submission and the parting word. Now, my dear, to Sheikh Said Salman, the last questions. How can religious language, symbols, and campaign reshape societal attitude toward drug in Nigeria? We all know that even sometimes now you see some religious scholars saying it indirectly, so some of those languages, how can we use it as a way positively to influence the attitude of our people around us and reorientate them? And also, when you are done with the questions, give us your parting words, sir.
Okay, thank you very much once again. Let me start by saying that when you're talking about symbols and sacred language, in Islam and to the Muslims, it carries weights in Nigerian society. That's why at times people still believe that religion is opium of masses. If you look at the way some people take their imams, take their pastors, you will still be thinking that in a way, religion is opium of masses. So that's by the way, when you're talking about religious language, what are we talking about? As Muslims, religious language mainly can be found in the Quran, and the saying of Prophet Muhammad sallallahu alaihi wasallam. For example, for the benefit of this, for the purpose of this discussion, we have verses like "La taqtulu anfusakum, inna Allaha kana bikum rahima." Don't kill yourself, for Allah is all merciful with you. Quran 4 verse 29. Then also in Quran 2 verse 195, Allah says, وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ. Don't use your hand to destroy yourself. Then, in the saying of Prophet Muhammad sallallahu alaihi wasallam, there is this popular saying where he said, "Al-khamr umul khaba'ith," intoxicant, it is the mother of all evil. Then, kullu muskirin haram. All intoxicants is unlawful in Islam. So we can use these scriptural exhortations with public campaign using religious symbols. Then talking about symbols, talking about a crescent, star, mosque, Kaaba, and whatever. These are some of the symbols we have in Islam. Whenever you see any of these things, you know that, okay, these are the Muslims. These are the Muslims. When you want to start our Ramadan, we must cite the crescent. Then when you see Kaaba, you know what Kaaba connotes to us as Muslims. All things could be used in billboards, radios, dramas. Then mosque announcements also could be used to promote not ostracism. Here I want to stress that word ostracism. So when you are talking about that someone has experienced addiction or whatever, we are not saying it purposely to stigmatize or to ensure that the person is totally isolated from the society. No. So we talk about empathy, and we talk about, you ensuring that you are not condemning, you are not judgmental whenever you are talking or addressing this issue. So I have the following ways by which we can make use of the religious language, symbols, and whatever. One, there should be, if it is possible, national sermon that can come up weekends where leaders will be invited to talk. And when they are talking, they are expected to talk compassionately. You can see the word compassionately about addiction. Then also we can use religious festivals, Eid al-Fitr, Eid al-Adha, then some events that are not festivals in Islam, they can be used. The government usually give us public holiday during the Maulid Nabi. It is not festival in Islam, but it's one of the events that change the world. We can make use of that period also to talk to people and to present some people who are undergoing recovery journeys from this drug addiction. Then we create visual campaigns, posters, T-shirts, scripture quotes that emphasizes dignity of human being. For example, if I put on a T-shirt where it is written there, El Khamur Umul Khaba'ith, intoxicant, it is the mother of all evils. Already I've passed a message. Then even on television, we have something like that, just like we have on tobacco, that is the smokers are liable to die young, written in a very small wordings. But this will be written in a conspicuous way, that El Khamur, intoxicant, it is the mother of all evils. It's another way we can use religious languages and symbols to achieve this. Then also our khutbah can be a thematic one. Okay? By the grace of Allah subhanahu wa ta'ala, the lecture we are about to start today will be run for 1 month. And the theme of the lecture is El Khamur Umul Khaba'ith. Intoxicant, it is the mother of all evil. So week 1, we'll discuss it. Week 2, we'll discuss this. Week 3, till we get to week 4. So that's another area. Then also, we need to train religious broadcasters. When you talk about journalism, mass communication, it's a professional area on its own. So if you train them, that will save us from stigmatization. Because not everybody that come on television or radio that talks, they are saying what is expected of them. So if you train religious broadcasters, that will prevent us from stigmatization language. And also it will promote help seeking. And the last one is to mobilize congregations for welcome back initiatives that offer jobs, housing mentorship to recovered persons. So these are some of the ways I think we can make use of the symbols and sacred language in Islam. And on a final note, I have 4 things. 1, to the government. Our governments must enforce stronger policies and close the doors of easy access to drugs. Because to me, our government at times, they are hypocrites in the way they handle the issue of drugs. And that's why the question of, using someone that is very popular with drug taking as an ambassador. What are you telling other people? You are telling them that if you engage in it profusely, you may eventually become an ambassador. We should pick someone that has never committed such, that has never engaged in such, to be the ambassador. And you make use of his shining life for others, not someone who is still taking it. So what are we encouraging? We are not encouraging anything except negative things. That's number one. Then number two, religious leaders, the imams, the ahimma, the pastors, the teachers, we should consistently preaching against drugs. And while doing that, we should not condemn, we should not stigmatize, and we should not in any way be judgmental. And there also, we should always understand what we call empathy. Then the families. If you look at the families today, some families have abandoned their roles. The fathers are not doing what is expected of them. The mothers are not doing what's expected of them. Automatically, if these two people are not doing what is expected of them, what do you expect from the children? They will engage in negative things. And lastly, the communities must provide support and alternatives. This is where the popular saying of Yoruba comes in that ojú kan ló máa ń bímọ, igba ojú ló máa ń wò. Ìwọ bàbá ẹ̀ màmá ẹ̀ ló bí ẹ lóòótọ́. But other elders, they are there to correct you. They are there to guide you. So this is my parting shots on this program of us, on my presentation. And I want to appreciate the organizers of the program. And I pray Allah subhanahu wa ta'ala to continue to be their guide in all their endeavors. Assalamu alaikum wa rahmatullahi wa
Wa rahmatullahi wa barakatuh. Oh, as you are giving us those recommendations, I was just thinking, if we have a PhD student here, somebody that just commenced a PhD in counseling, psychology, and the likes, but they are going to see a lot of gaps to write their thesis. Thanks you for the wonderful submission. The last questions for the panel goes to Dr. Aroye. Dr. Aroye, so when you answer the question, you give us your parting word. How can collaborations among community, civil society, and government improve long-term psychological recovery and reintegration for substance users? So that how can the collaboration lead to a long-term impact? So you have the floor, Dr. Aroye.
Thank you so much for that. The long-time collaboration, of course, will definitely start from two or more organizations or individuals coming together. So we could start with, for example, the community and the government can collaborate on how to address the issue. Now, this takes us back to why and how and causes of substance intake. Why do people take drugs? The biological reasons people take drugs, which is probably they have family members that used to take drugs. The social reasons, many of these social reasons have been addressed. The psychological reasons, probably they're going through one form of mental health problems or the other, or they're going through loss of loved one, loss of job, or it could just be low self-esteem or feeling of insecurity or inadequacy, or the feeling that they just want to feel among. And of course, we have the social media that is painting the world in a different light. People see themselves as unworthy or less useful or less worthful because of what they see on social media. So these are some of the causes. Now, if these causes are addressed, the community and the government can come together to create policies, like we mentioned before, that addresses each of these problems and find solution to it. Like most of the speakers had said, we have to go back to the basis, what works well with us as Nigerians and what fits well with us. Then also we have public-private partnership. This is basically resources. You can't address social issues without resources. It's impossible. You need resources, not just money, but you also need human capital. And I think Ustaz Said also mentioned that there has to be that volunteerism. Many people have to know that there has to be a point in time where they will do this for the society, for the betterment of the society, and not because they want to get paid, but because of that feeling. And also that feeling, people get from volunteering is also therapeutic. So that addicts can also be incorporated. So there has to be resources when it comes to housing. We see some of these people take drugs, they're on the streets, they lost their home, some even because there's a strong correlation between substance use and addiction and gambling addiction and other forms of addiction. Some of them are gambled their homes, they're on the street, they don't have jobs. So some of these things, there's a need for public-private partnership to address them, to mobilize. Then also there has to be training. I think that also was mentioned earlier. But another very important part is the psychotherapy. It's very important. We have to move away from the perception that my child is not crazy, so why do I need to take my child to, say, psychologist? At the point where parents or individuals notice that there's a lingering problem, then it's okay to seek help at that point in time. So we need those resources to train our therapists and upgrade their skills, and at the same time have what we call the parapsychologists. We call them parapsychologists not because we use that name because basically they are not psychologists, but we train them on certain skills on how to address more like a first aid, mental health support on how to address issues before it's transferred to the psychologist or the psychiatrist or the relevant mental health worker. Okay, so another thing is there has to be data to address this issue. Now, we don't know the data. We see people on the streets. We even see the police. We see people people in uniform that take these substances, but we don't have data. So I think this takes us back to research. Research is important to address long-term issues because we have to understand what is happening now, what was many years ago, what is happening now, and what we need to do. And bringing in collaboration with other countries that have done the same and see how effective it has been. So it's very important that there has to be data, and there also has to be data sharing with other within the country and outside the country. Data sharing in the sense that there are some drugs that are prominent in Africa that are not in the Asian country, and there are some drugs that are in the Asian country that are not prominent in Nigerian countries. And also, to address this issue on the long term, we have to look into ideologies. Now, we have some countries that don't see tobacco use. In fact, some people will go to the mosque immediately after Juma, they are smoking. Even the imam himself is smoking. Why? Because they don't see it as a sin nor a crime, because it's not a criminal act to take certain drugs in some countries. So the ideology of the individual also matters. We have to emphasize that the ideology amongst us is that whether you take it in a little form, in the max form, you take tobacco, you take alcohol, or you take marijuana, they all fall in the same category. So if you have to address the long-term solution or collaborative ways to address it, we have to also look into all of that. Then also there has to be co-design of various programs. I think Prof had mentioned some of those steps that have been taken by some associations to address this issue, but it shouldn't be one organization thing. All organizations, we all have our small groups, our large group. We should openly talk about it, and we should also educate our children in our homes, in our community, in our small mosques after the khutbah. We can even make it the khutbah for that day. And also in schools, even though some of the challenges I observe is that many children in schools are not able to go and see their counselors. Why? Because Nigerian counselors teach. So teachers punish students in class. So students are unable to go to such teachers, even though they are the counselors, because of that punitive role they've taken while teaching. So there's a conflict of interest. So if such things have to be addressed in the long term, we should be able to let our counselors be counselors full time. They don't get involved in scolding the children. Yes, they have to monitor the children, right? But when it comes to scolding them, not the way the teachers would, not using sticks or hitting them, rather they do the verbal therapeutic scolding, which is more compassionate. So I think that will also address the issue in the long run. My parting words will be that like I said earlier, I'm happy we're having this discussion on substance use. We have to understand the dynamics in Nigeria. So some time ago, I saw a video of a girl who was celebrating her 18 years birthday, and she was popping marijuana. She had to pop it 18 times, and she was really praised by her friends. Now, there's something we must understand, and that is that our youth are not focused on what is important. They are focused on what they want, their desires, their gratification, what feels, what they think makes them happy. The word, the perception they see, the things they watch, the things they see. And we know that we don't have policy that regulates our social media. We don't have policies, even though there might be policies, but it's not like it's taking toll. So I think my parting words will be, we all should go back to the foundation of what we are and who we are in our various communities. We should help other people address such issues. When we see other people, we should educate them on the proper way to address it. We shouldn't, just like it was said, we shouldn't mind our business. We should educate people. Oh, this child is taking drugs. These are the ways you can help this child. Let this child go to social place. Let them see social person, connect with social individuals. It will help them. And we also have to let individuals know that when people are hooked, it's not an easy process. Some people just want you to stop, like stop. It's impossible. They can't just stop. It's even being religious or being spiritual is not enough. It takes a lot of intentional applications, like number one, resilience. It takes self-control. Okay, it takes determination. It takes time and energy. It takes mental preparedness. So, but just like Prof had also said earlier, that prevention is the most important. So for those that are not involved, we have to make sure they are not involved. So we don't focus only on the bad part, or it's the bad, it will kill you, you will die. No, we should also let them know that yes, people take drugs because they enjoy something in it. You know, for those that take drugs, you need to understand how they feel. They are like in the moon, flying. Some of them feel like they are flying, actually flying. So that sensation, that pleasure is high. You can't take it away from them. So if you're asking them to stop, you have to give them, your Bible say, if you want to call or something like that. You can't just take it away without replacing. We have to replace it with something they also enjoy. May Allah guide us all. Somebody come to our.
Thank you for the top-notch submission. We really appreciate all our panelists. In summary, from this discussion, for this panel discussion, we're able to realize that as far as the prevention, the detections and preventions of substance use is concerned in Nigeria, there should be the use of evidence-based practices by medical personnel, clinical psychologists, and also counselors in school. Also, it is also noted that there should be use of integrated religious model that will bring people from various walks of lives, individual, community, civil society together, that work together in order to fight the issue of substance abuse in Nigeria. Also, it was also noted that we must go back to the base, whereby we entrench the principle of Ubuntu philosophy, principles of togetherness, whereby every individual within the society will see themselves as a role model that will understand the fact that they have the personal sense of responsibility to model the upcoming youth. Also, we should also endeavor to avoid the issue of labeling and stereotyping those that are involved in these cases of substance use. And finally, there should be training for our medical practitioners and also the non-medical practitioners, such as the psychologists, teachers on global best practice to handle the issue of substance abuse. As I said earlier when we started this program is organized by the Muslim Lecturers Association. And under the Muslim Lecturers Association, we have a committee called Committee on National Issue Development and Advocacy, SINIDA. At this point, I will call on Dr. Lukman Rahimi from Brunei to tell us in 1 or 2 minutes about SINIDA. And finally, we have some word of encouragement from the president of LMA, Professor Adedeji. You have the floor, Doctor.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. First and foremost, I would like to thank all participants who have spared their valuable time to attend this Independence Day discourse. I also want to thank the panelists, Professor Oriagba, Professor Ira Sulaiman, Dr. Temi Tokwe Aroyewu, and also our Imam Saeed Salman, a deputy registrar at Yaba College of Technology. This is an international discourse, and I'm really very proud to have this quality discourse today. Going straight to the task assigned to me, Muslim Lecturers Association is a vibrant association in Nigeria. To push some of its agenda to the public domain, a committee on national discourse was set up, and that particular think tank committee is called CNIDA, that is Committee on National Issue, Development and Advocacy. And the purpose of that particular CNIDA is actually to cascade to the public Islamic voices on national issues. Today, people are celebrating Independence Day in different ways. We feel as patriotic individuals, patriotic intellectuals, we should dissect some of the ills in the society and come up with ideas that is going to support the policies of government. And for this particular Independence Day, we found it worthy to discuss issue of substance abuse, addiction, among others. So at the end of this particular discourse, within the week, we are going to come up with a communique, which we are going to send to relevant government agencies and also the media. So that is what CNIDA is out to do. And most of the things we do are basically discourse, webinar, press release, and also press statement. Finally, I want to thank everyone, including the moderator, for this particular landmark discourse. Thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thanks you, Dr. Lukman Rahim. That is the chairman of the committee. Now, finally, before we round up the program, we'll move on to, we'll call on the president of LMA, Muslim Lecturers Association, to give us one or two advice in person of Professor Ahmed Adedeji. Prof, sir, you can unmute yourself, you have the floor.
Thank you so much. I'm very, very grateful. I really thank you for the organization. It's a beautiful outing today. I must thank the chairman and the members of the committee for an excellent job done. And I know that we would not have succeeded very well if we had not had our speakers. I am very, very excited. Thank you for dissecting the subject matter to the details. And thank you for leading us into solutions that are very important for us to take forward to ensure that the nation is saved from the danger of abuse, substance abuse. And I really feel touched. We're 65 years in celebration. And I can imagine if we have data showing what's our growth rate. So we have an annual data suggesting how we're growing in the country. And we could estimate our population from that angle. It is true that that is a signal for development or an indicator for development and development planning. But there hasn't been data to say how many people go down the drain every year amongst our youth who are supposedly the future of that country. It means that there is a lot to be done on our side as Muslim academics. There is a lot to be done by us in the public sector and in the private sector. If we do have the number dwindling every year and seeing thousands rolling per millions of people, population we have into this abyss, surely we can't talk about a viral country coming 70, 80, 100 years celebration. This is why it is important for us to nip this now. The future of a nation depends on the quality of the people or the citizenry. At a discussion yesterday, we were talking about decolonizing knowledge, decolonizing the curriculum, because we seem to be Eurocentric, and the problem that is happening in Europe and other places are also still happening with us. We have our own epistemologies that supports our development as Africans. And one of them was what Mama said the other time. Oju kan lo ma bimo. Ìgbà ojú ló máa ń wò. How has this come into our curriculum? And so I am also taking this opportunity to ask us as academics who are present here today. It is time to continue to support the South African agenda. This has been very ingrained in South Africa because they wanted a decolonized curriculum and they kept working on it. We also need to look at it from that perspective. As our children go to primary school, they go to secondary school, they spend 1/3, fairly 1/3 of the hours of the day meeting with teachers. And they spend more time in the university environment. If we want a beautiful future, it means we've got to really work so hard. And I really appreciate all the suggestions that have been given to us today. I'm sure that the Senate will be working on it to ensure to push it into the public space and for policymakers to also have access to it. MLA is very grateful to all of us. We really thank you. And we hope that many more of this will come up. And this should cascade into we taking research topics and also guiding many people in psychology, in the field of medicine, in the field of educational counseling to take up very critical issues that are being discussed like today. I want to, on behalf of the management, the entire management of Muslim Lecturers Association, all members present here or absent, thank you, our discussant, for a great job done. And I also want to thank the committee. We really appreciate your effort. We've been seeing it and it is impactful. May Allah subhanahu wa ta'ala accept it from all of us as act of ibadah. Forgive us our shortcomings, give us strength to build our nation stronger, guide us through every step that we will take to make our own time in this world be beneficial to others, so that when we return to him, he admits us into his pleasure and paradise. Wa jazakumullahu khairan. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. That's a wonderful speech from our president. We thank everyone for coming, the panelists and those who also attend the programs. As has been said by our chairman, we are going to all the information that we gather from this discussion, we are going to put them in the national space, in the media, and also the video will be in the recorded version of the video will also be on the YouTube space, though we have the live streaming now going on the YouTube. So we thank everyone for coming. Assalamu alaikum wa rahmatullahi wa barakatuh. Happy Independence Day to me and every one of us over there. Have a nice time. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh. Thank you very much. Jazakumullah khairan.
Wa alaikum salam.